Welcome to The Pulse with Lauren Bango, a DLL podcast series. This is your place for tips, trends, and insights into the world of healthcare finance. Now, here's Lauren.
Welcome back. I am joined today by Rob Arcilla. Rob has recently taken on the head of program management in our healthcare team. First of all, congratulations, Rob, and welcome.
Thank you. Thank you, Lauren. Appreciate it. It's great to be here. And I'm looking forward to this session. Just a quick tidbit about myself. Been with DLL for 3.5 years. I was with our joint venture with Philips Medical Capital, managing one of the major segments that they had with Philips Healthcare. So glad to be here and just looking forward to having this session with you.
Awesome. You certainly have some great healthcare background, and let's dive right in. I know that RSNA is right around the corner. I think that you and a number of the team members are going to be there. Is that right?
Yeah, that's right. We have some account managers, program managers, as well as members of the healthcare leadership team and DLL leadership team that's going to be there. So I'm looking forward to the annual RSNA. I'm looking forward to interacting with not just our vendors, but folks in the healthcare market that we all have relationships with.
That's great. Well, I thought it would be appropriate for us to touch base and get an update on the trends we're seeing, related to imaging, obviously, but also really specifically in the surgery center markets. Would you mind just kind of touching base on this?
No, not at all. And that is one of the biggest trends in the shift toward outpatient surgery centers. These centers they're becoming very popular because of the cost effectiveness nature and the convenience for patients. So they're equipped to handle a wide range of procedures that traditionally required hospitals to stay, but now are available at these outpatient surgery centers.
Awesome. And how does imaging equipment fit into this trend?
Well, it's imaging equipment is absolute crucial in the outpatient surgery centers. High quality imaging just allows for a very precise diagnostics and at the same time minimally invasive procedures. So what does this mean? This means that quicker recovery times for patients, less risk for patients, and we're seeing a significant investment in advanced imaging technologies like MRI, like CT scans, as well as ultrasound systems.
Can you give us an example of how these advancements are being implemented? Because it sounds like it's the way of the future.
Absolutely, it is. Take an MRI machine for an example. Newer models are more compact. They can be installed in smaller facilities, really making them ideal for outpatient centers that we see. These machines provide high resolution images that really help the clinicians and the surgeons better plan, better execute procedures with greater accuracy.
Amazing. And I am sure that scheduling an MRI in an outpatient surgery center is a lot easier than going into the hospital as well. But what about the integration of AI in imaging equipment? Is this something that you see the surgery centers adopting as well?
Absolutely is. In fact, AI is making such a big impact. So if you think about AI powered imaging systems, they can analyze and scan faster, more accurately than before. They not only assist in detecting anomalies, but these are anomalies that the human eye may have missed in the past. So these AI powered systems really provide better patient outcomes. I'll give you an example. AI algorithms can really highlight areas of concern real time during a procedure, enabling a surgeon to make informed decisions on the spot. And that's really crucial to not only patient care, but the decision making of clinicians that we see in these surgery centers.
That's fascinating. Are there any challenges that surgery centers face when it comes to adopting these new technologies?
Unfortunately, there is. And one of the main challenges is really cost. If you think about advanced imaging as well as AI integration, it requires a fairly significant upfront investment by these surgery centers. However, we know that the long-term benefits, such as improved patient care, better operational efficiencies, better workflow, it often justifies the expense. The other challenge is making sure that staff are properly trained to use these new technologies, but you'll also use them fairly effectively.
How are the surgery centers addressing these challenges?
Many of these centers are really partnering with equipment manufacturers as well as tech companies to provide the proper training, but also the proper support that their staff needs. They're also exploring financing options to offset some of that large upfront cost. And we're seeing a rise in flexible financing solutions, a little bit of a reinvigoration of the FMV leases, but also technology upgrade models. These just allow the facilities for the use of the equipment rather than paying for the ownership up front, which can be more manageable financially speaking.
Can you explain a bit more about these models and why they're gaining popularity?
Sure, from a technology upgrade standpoint and even an FMV lease reinvigorating itself, it really is regaining popularity because of the reduced upfront cost. But it also provides the financial risk associated with the purchase of owning an expensive medical equipment. They all allow the facility the ability to upgrade to the latest technology at the end of the term. And at that time, with the new technology release, warranty periods, etc., it really comes in play and provides the flexible option at the end of those lease terms. I'll give you an example. If an ultrasound machine is 5 years old and it's on a 5-year lease, at the end of that lease term, there's some flexibility with a fair market value lease, as we know. Part of that flexibility for clinicians is, do I want the latest and greatest? And if I do, I have the option to return the equipment back to the leasing company, you go back to the manufacturer and replace it with the latest and greatest technology. If that particular doctor or physician is not yet certain that they want to dabble in the new technology, they have the flexibility on continuing to rent on a month-to-month basis the existing technology that they have. And at the same time, if they said, hey, we really believe the useful life of the asset is going to be a little bit longer than our lease term, they have the option to own it by buying out the equipment at the end of the term. The good news is it gives them several flexibility with a fair market value lease while addressing the issue of not having that upfront cost and spreading that cost over time while paying for the use of the equipment and generating revenue that the equipment provides.
That sounds like a game changer for many facilities. Are there any challenges or considerations that surgery centers and imaging facilities should be aware of when it comes to equipment finance?
It definitely is. And one of the main challenges is ensuring that the financing option aligns with the facility's long-term financial strategy. It's really important to consider the total cost of ownership, including maintenance and potential upgrades down the road. Additionally, facilities need to really stay informed about regulatory changes, reimbursement policies, as these can impact financial viability of certain equipment investments.
Great points. Before we wrap up, do you have any advice for healthcare providers looking to navigate these trends and make informed decisions about the options for equipment finance?
Yeah, absolutely. My advice would be to work closely with financial advisors, in particular who work in the healthcare space. I can tell you that the DLL team in the healthcare segment have a lot of expertise, but also have a lot of experience in seeing how to navigate around these trends and provide valuable insights that help tailor financing solutions that really meet that particular facility's specific needs. It's also crucial to stay updated on market trends, technology advancements, just to ensure that the investments are future proof and aligned with patient care goals at the end of the day.
Thank you so much, Rob, for sharing your expertise with us today. This has been incredibly informative. And because I know you've listened to the podcast before, you know that I am going to ask you to leave our listeners with one nugget. Anything you want to share to them?
Absolutely. The nugget I'll say may sound a cliche, but there's so much truth to it. Starting, what problem am I solving for with the customer? And then that'll lead to the right solutions and the right steps, not only for DLL, not only for the customer, but also our vendor partner.
Thank you again. And please remember, if you'd like to meet with our team at RSNA, please reach out. We would love to connect with you in Chicago. Thanks again, Rob.
Thank you, Lauren. Appreciate you having me.
Thank you for listening to The Pulse with Lauren Bango, a DLL podcast series. The opinions expressed in this podcast are solely those of the participants. Nothing herein should be construed as legal, tax, accounting, or investment advice. Join us again for the next edition of The Pulse. And thanks again for listening.